however, that we've gotten to that point in time where perhaps we need a balance. And I've already mentioned that one is lawyers or the law profession, spearheaded by judges, the courts. But the other is also religion, in the case of Ghana. If you go to the hospitals and immediately patients, people are pronounced dead, and it becomes evident or clear that something wrong has happened, family members are very quick to say, well, God gives and God takes. God has given and God has taken. There's no way this guy is going to come back, even if we sue the entire Ghanaian government. Whoever you sue today, he is dead and dead. And let's pray for his soul. That's the best you can do for him now. In fact, maybe someone may even say, if he dies and you end up in court, you are further making his case for heaven more difficult and complicated, because he's dead and he's thinking about how to petition himself before God, and God will remind him that even as you're dead, your people are there busily fighting. Please, let sleeping dogs lie. Don't go and make a further case on this. It is therefore evident that as a society, we may not even at this stage have come of age when it comes to the issue of patients' rights, because we do believe that the whole medical establishment is anchored on religion and spirituality, and the doctor is only an instrument. And because he's only an instrument, he can get it wrong. He's an instrument to be used, and that instrument itself can get it wrong. If there's something wrong with the instrument, that thing wrong is coming from a higher source, and that higher source cannot be blamed. The doctor can equally not be blamed. Until there's a mental shift, there's an angle in which we start thinking of the fact that professionals have minimum standards of behavior. And in that minimum standards of behavior, their own people can evaluate and determine what is the proper standard, what is the proper way of behaving, and whether or not a particular medical professional has acted in a manner which is inconsistent with or below that standard of training that a person is supposed to apply. Therefore, it's imperative for us to understand the minimum, the following minimum. One, that all doctors do have a duty of care. And I'm taking my time to quickly run through these, because these charters are there, but very often people don't open them. Now, until you open them and until you know what is in there, you will not even know what to claim. All doctors do have duties of care. Now, doctors are not alone in this. Lawyers do have them as well. All professionals. As we sit in this building, it was built by an architect. That architect designed the building according to certain specifications. There were engineers involved. Everything we see has been done according to certain specifications. If this building comes down without anything happening to it, and it has been established that this building ordinarily should have lasted for 100 years, somebody must be guilty of that, because the building is not up to 100 years yet. So every professional has a duty of care. Medical professionals have duty of care. That duty of care obliges them to act in a certain manner and to apply a certain degree of skill. That duty of care contains something called the standard of care. That standard of care is what imposes the minimum threshold of behavior. So what should doctors do? If patients appear before doctors, what should they do? We all know stories. Honorable Dr. Nsiah-Sarri, as the ultimate presidential advisor on this, who is one of our foremost and most respected medical practitioners in Ghana. In fact, long before I met him, I knew his name way ahead of him, and that was long before he became presidential advisor. But he will tell you this. Dr. Nsiah-Sarri, I'm sure, will tell you this, that if you appear before a doctor, there are certain minimum protocols that a doctor is supposed to take you through, minimum protocols with whatever presentation you come with. But we also know that there are some doctors, you appear before them, you are treated before they even ask you your name. By the time you mention your name, perhaps by some prophetic means, you've been treated. We just take it next. The long and short is there are standards of care. There are minimum things. Before surgery is undertaken, what are the minimum protocols? There have been stories of people having had syringes and sponges and all kinds of things left in their bellies and their bodies sewn up. If there are minimum checklists and if there are protocols, once we go through the checklist and the protocols, we should know that something is wrong. All professionals, just as when you enter into a plane, before the pilot flies that plane, there are checklists minimum before the plane starts taking off. The reality is that some of our professionals are not or may not applying the minimum standards. As I stand here, some of the things that I say or will say are not particularly popular. And one of them includes the fact that a lot of Ghanaian doctors, perhaps because of the poverty of salaries, are compelled to maintain multiple practices. So he will come to Korle Bu, which is the Ghanaian, which is the government establishment, where he is paid monthly, and where he is paid regardless of the performance of his work and the output of his work. He will show up there, perhaps first or last, and whenever he shows up there, he's perhaps in a hurry to go to the place where he's now going to earn properly. So we all know that very often the shoddy treatments and the shoddy administration of medical interventions happen in government establishments, where standards of care and where duties of care are often breached. And in this respect, I would also want to bring to your attention the fact that, as the Constitution says, everyone is entitled to be treated with dignity. It has been mentioned already how, by the chairman who left, that how, these days, medical practitioners and indeed caregivers don't seem to be respectful of patients' rights. Patients are screamed at. And funny enough, one of the biggest victims of these tend to be pregnant women, from the stories that we hear. Women who are, and I think part of the reason is because pregnant women at the stage of labor are going through a lot of distress. And because they're going through a lot of distress, they probably tend to be a bit more clumsy. So they are the ones who tend to be screamed at, who tend to be mistreated, sometimes lying on the floor. And you go to our hospitals, and unfortunately, a lot of our public hospitals tend to look sometimes like refugee zones. You see a lot of people in a common space, and they're crowded. People sometimes literally have to walk over people. The truth of the matter is that we are all entitled to be treated with dignity by the Constitution. But what does the right to dignity mean? Does it mean that the government have to convert the hospitals into hotel facilities, even when there are no resources? But in the context of the doctor, in the context of the caregiver, they do not have to exacerbate whatever dignity situations we have in the hospitals by further treating people with so much disrespect, among others. A patient has a right to know. As I indicated earlier, patients are seen sometimes as, the quiet patients are seen as a model patient. That means the patient who has too many questions. This particular medication you're about to administer to me, what are the side effects? By the way, who are even the manufacturers? Can I know something about the last time a newer version was manufactured, and whether it's in Ghana? Is that what you're going to use on me? Is it not even expired? Can I look at a date? I'm sure you're likely to, the doctor is probably going to say, I think there are about 20 other patients. Can you just take your time? When you're ready, you come in, let me take care of you, etc. But the truth of the matter is, patients are entitled to know. The reason patients are entitled to know is because the risk of treatment is resident in the patient. And that's one thing we don't realize. The doctor bears zero physical risk. The doctor administers the treatment, and the patient takes something into his body which may have consequences for him. I already indicated to you that there have been circumstances where patients have been administered anesthesia. Simple, to put them to sleep, to get them to lose some consciousness so they can undergo the medical treatment without much pain. And that is not supposed to kill. But there have been stories of people dying by that pre-surgical treatment, or rather pre-surgical procedure. Now, the reason that would happen by all standards is that somebody has been negligent. Is the drug expired? Was the patient injected in the wrong place? Was the patient not asked certain questions before the drug was administered into his body, and therefore his medical history has reacted with the drug, which has resulted in that? The long and short is, somebody may not have done his work. And the question then is whether the patient should have been given a bit more knowledge, a bit more right to ask a few questions. The right to privacy. What does the right to privacy mean in the context of our hospitals, particularly our public hospitals? Which tend to have all the pressure of a lot of people, and and many patients are in the common space. So, for example, you go to a hospital, you see a lot of people sitting there. Everybody knows you're a patient. You know they are patients. They too know you're a patient, and they've seen you. So they've seen you at the renal lab, the renal unit of Korle Bu or Komfo Anokye or one of the big hospitals. Everybody knows you have a renal problem. The fact that you're sitting there, you are an open advertisement. Sitting there, everybody sees you, everybody knows what you have. They've seen you at the gynecological unit. You're sitting waiting to see a patient, and there's a long queue. All of you are sitting on a bench waiting to see one doctor. Everybody knows you have a gynecological situation. What does the right to privacy mean in context like this? They are beautiful on paper. They are beautiful in the patient's charter. But in reality, you are going to have to deal with infrastructural situation. If you present yourself in one of the private hospitals and you're paying a lot of money, chances are that you walk in there, the doctor gives you an appointment, you even have the opportunity of speaking to him on the phone. He knows you are on your way to the hospital. As soon as you get there, out of your car, in front of the doctor's office, you enter the doctor's office, you finish, you leave the place. You can make it easier for yourself. You can even wear a mask. Nobody will know whether you're the one who is there. But the long and short is, poverty can undermine rights. And these rights are beautiful on paper, including the right to privacy. The right to privacy will be hard to be enforced in Korle Bu, Komfo Anokye, and many other public hospitals. The right to treatment and the options being advised, I've already mentioned that. But what is the right to refuse treatment? What does it mean? If I have the right to bodily autonomy and bodily integrity, it means I should have the right to refuse treatment. If a doctor diagnoses you of a particular disease, should you have the right to say, thank you, but no thanks, I'm not taking the medication? I think Ghanaian doctors in Ghana don't do too badly with that. Generally, they respect that. You say you don't want, we don't even have enough of them. So you don't want treatment, goodbye, just go home. You know, we'll see you on the other side of town, which is usually the cemetery. But otherwise, they will not force a treatment on you. But in some jurisdictions, that part can be complicated. Sometimes you don't want treatment, and they still want to talk to you about the fact that, look, you need treatment. But if you look at other diseases, such as COVID, such as other infectious diseases, what does the right to refuse treatment mean? Recently, we were all compelled. All of us were compelled to go for COVID-19 vaccination. And you know how we're compelled? We're compelled because without the vaccination, there were consequences. There were public spaces you couldn't go to, you couldn't travel, there were a number of things you couldn't do. So we're compelled to go for treatment. Is there truly a right to refuse treatment? The right to liberty. I started by telling you about my client who was detained, a pregnant woman who had a baby. From age 0, the baby was there for 6 months. The baby left the hospital or the medical facility after 6 months, which also then means the baby didn't see sunlight for 6 months because they were inside the room. And the hospital was even more annoyed by the fact that she owed only the treatment, only the labor cost and having the baby. But now she had eaten their food because they fed her. So she ate their food for 6 months. And now all of it is free. She didn't have to pay. And that's why I decided never to go to La Polyclinic at the time. The right to decency and to be treated with respect, as the patient charter will tell you. What does that mean? Harassment and insults. Sometimes you hear open insults, especially of folks who are not necessarily very educated and who, in the hospital context, feel intimidated, are under so much distress because they are sick or they are pregnant, and then they get subjected to all kinds of mistreatments or treatments that people would deem below standards. The right to visitation. All patients have the right to visitation. I think, again, hospitals don't do badly on that. There's a visiting time. All of us can go to the hospital at a certain time to visit the people we have to visit. But does that include the right to visit your relative at any point in time, or must we all respect the window of visitation, which many hospitals tend to administer for good reasons? All patients have the right to pastoral care and spirituality, spiritual services. The right to pastoral care and spiritual services. The reason why patients in particular must have this right is because the status of being a patient is one that puts patients in a certain transition zone. When people are patients, there are two options. They are very close to both worlds. They are very close to where they are now, and they are also very close to the other world they are not quite sure about. At that stage, patients' spirituality and the extent of intimacy they would want to have with pastoral care is one that should not be denied. And you'll be surprised that some patients may actually not make it. They will not make it, i.e. they will die, simply because they were not given that requisite pastoral care. Pastoral care is part of the psychophysiological treatment. It's a psychological aspect to the treatment. And the fact that the person knows that, look, he's so unwell, he's been given the communion. You know, his pastor or priest has visited him, and they've administered a communion to him. For him, as far as he's concerned, he's had the body of Christ in his body. He's had the blood of Christ in his body. that is the beginning of treatment. Indeed, doctors know this more than I know, that placebos are a very important part of treatment. So people's belief people's belief in particular things cannot be taken for granted. And even if the doctors do not believe in same, they will have to acknowledge the fact that when a patient believes in something, it is fundamental. So you don't have to question it. You don't have to check whether or not this will work or whether it's efficacious. What is important is that the patient believes it, and the patient's belief may be part of the reason why he's actually going to start on the road to recovery. So pastoral care and spiritual services are rights that should not be denied or deprived of patients.